27-year-old Andrew Ouko Obilo from West Kachiang village of North Kabuoch Ward in Homa Bay County is undergoing treatment for multi-drug resistant TB.
Ila ugonjwa ya TB ikanishika, ila sikujua kwamba ni ugonjwa wa TB ndio imenishika. Ikanibidi nikuje nyumbani. Wakati nilikuwa nimelazwa Ndiwa, niliweza kutoroka nikarudi Mombasa. Na wakati huo nilikuwa nimeanza tayari madawa na nikaacha. Nikapandishwa gari, nikarudishwa nyumbani hapa Unga. Nilianza madawa Ndiwa, nikapelekwa Homa Bay, na mpaka saa hii naendelea na madawa mzuri. Hata saa hii siko katika ile hali nilikuwa nayo.
A DOT nurse visits Obilo every day to administer medication as part of the recommended daily observed therapy, DOT. A community health volunteer also visits the household and teaches on proper use of insecticide-treated bed nets to prevent malaria, which is prevalent in the area.
One of the things that I appreciate so much up to date is that Andrew is able to walk. He came to the hospital. During that time, he was very weak and could not do anything. In terms of walking, his household chores, and even eating, it was a problem. He was being fed through pipes.
The new funding model NFM, running from October 2015 to December 2017, gave Amref Health Africa in Kenya the mandate to implement key components in the National Strategic Plan as stipulated in the TB-HIV Joint Concept Note. The goal was to accelerate reduction of TB, leprosy and lung disease burden through provision of people-centered, universally accessible, acceptable and affordable quality health services.
How the government gets funding, it comes either through the national government or we get funding through a non-state organization. So the national government mainly takes care of treatment and patients and also strategy and policy, while the non-state, in this case Amref, takes care of mainly community related activities.
Our mission is lasting health change in Africa. We work very closely with communities, with the National TB program and the county governments and the Ministry of Health in general, to just ensure that those missing cases of TB, we look for them and we are able to bring them to treatment.
Our partnership with Amref has been stronger in a way that we do joint work planning, collaborative work planning, so that the TB control activities flow smoothly.
One of the things that we've really put under, and Global Fund also ensures that it is a mandatory thing, is really we have to have a component of community system strengthening. And in this case, it's actually trying to organize the communities into what we're calling community units so that they are able to really address the needs of the different communities that they are having.
In Kenya, street families suffer a myriad of health problems and are at high risk for TB. Other key populations include urban slum dwellers, healthcare workers, migrant populations, refugees and other asylum seekers. Amref Health Africa in Kenya, in collaboration with the government and other stakeholders, implements interventions designed to reach these populations with TB services. Amref Health Africa in Kenya conducted on-the-job training for health personnel in health facilities to conduct nutritional assessment and counseling for patients. Amref also supported the facilities with anthropometric equipment for measuring patients' BMI, MUAC tapes, macrotoisis and nutritional charts.
For the patients to have a good adherence to treatment, they must be well nourished. Anytime we have patients who are either moderately malnourished or severely malnourished and their own TB treatment, it becomes a bit hard for them to adhere to treatment.
Outreach was one of the main activities of the project to find missing TB cases.
If a driver and a conductor are on TB treatment, how many passengers do they carry starting morning to evening? We used the prefects at the stage to reach them, because without the prefects we wouldn't have done that work. And we had like 4 cases, smear positive, instant.
The CSS integrated module concurrently addressing HIV, TB and malaria worked well in Kwale, one of 3 counties where the approach was piloted to generate lessons for a scale-up of the model.
Mimi wanatembelea nyumba 100 na nikitembelea hizi nyumba huwa naelimisha TB, HIV and malaria. Nikielimisha na nikikuta kuna mmoja ambao kama ni mgonjwa, ninamrefer aje kwa zahanati ili aweze kufanyiwa utafiti.
We have eradicated cases of severe malaria. The indicator of people referred for HIV testing. Since WAFA came in a month, we test over 100 people, something which was not there initially. So integration of malaria, HIV and TB has really improved the health status of our community.
TB in prisons and detention centers is a growing problem. Inmates are at greater risk of developing TB due to their close, prolonged indoor confinement.
Niweza kupatikana na hiyo ugonjwa wa TB ambapo nang'ana ilikunywa dawa juzi ndio nazidi kutumia na hiyo dawa inanisaidia.
The project employed laboratory technologists to work in the high-volume health facilities. The project trained health personnel, constructed and renovated laboratories, and equipped laboratories with gene-expert machines and accessories, including cartridges and falcon tubes.
Where we are, our equipment is a 16 modular equipment that runs 16 samples from 16 patients within 2.5 hours. We've really had a good case detection rate, and we are getting more and more cases.
A comprehensive national TB monitoring, evaluation and research framework was developed to coordinate stakeholders as part of progress towards the one country strategy.
So we have held numerous quarterly review meetings with the sub-recipients, and as we give them feedback, we look at what they have done and we ask ourselves the questions on what are the lessons that we are learning as a principal recipient and also as sub-recipients.
Activities to increase case detection and improve the care of children with TB have also been intensified.
Tumesave lives mingi sana. Juu watoto walikuwa wana misdiagnosiwa, wanaambiwa ni pneumonia na ni TB.
For a long time, Kenya's health sector has been implementing a public-private mix initiative involving the private self-financing sector in TB interventions. Engagement of private healthcare providers and especially solo private providers remains a challenge.
PPM means if I am a private provider, I carry out TB management practices as prescribed by the National TB Program. And very importantly, I record and I report that case, so that every single case of TB in this country is known to the Ministry of Health.
We are also getting a lot of support from CAP-TD on issues of public-private partnership. As you know, TB medication being donor-funded, the government is giving it for free, and there's a link that CAP-TD has established for us to treat TB at no cost at all to the patient.
Amref Health Africa in Kenya, through the sub-recipients, trained community-based organizations on organizational development and system strengthening ODSS interventions.
Tulikuwa hatujui kutengeneza records, hatukuwa na strategic plan, hatukujua finance policy, mambo ya marketing hatukujua, entrepreneurship. Wametufundisha vitu vingi na tumefaidika. Wametufundisha mambo ya HIV, sasa mambo ya TB tumejua, sasa hata tunaweza sasa tembea kwa community tukiwafundisha.
What we've done under the new funding model is try to bring these two entities together. We've had review meetings where we've brought together the TB program, Amref sub-recipients and the community health and development units with very good discussion and very good yield. And we hope as we move into the future, we'll have more collaboration with that. Otherwise, we could be succeeding in TB but killing the community strategy. And yet, both are important for the country. They are all strategies laid down by the government.